Today, we're going to pull back the curtain on something that happens after surgery. We're not talking about stitches or scars, but what's happening deep inside your body. It's this incredibly delicate balancing act of your body's essential chemistry, and, getting it right is absolutely critical for a smooth recovery.
So you might be thinking, phew, the surgery's over, the hard part is done. But here's the thing. For your body, a huge internal battle has actually just kicked off. The moment the operation ends is really the start of a massive new physiological challenge.
And that internal battle? It all starts with something called the surgical stress response. See, to your body, a surgery isn't just some neat little repair job. Nope. It sees it as a major trauma, and it triggers this system-wide, all-hands-on-deck, red alert reaction.
So what is that response exactly? Well, it's this powerful, complex cascade where your immune system, your metabolism, and your hormones all just kick into overdrive. Your body basically thinks it's been seriously injured, so it mobilizes every single resource it has to stabilize you, manage the damage, and get energy to the right places for healing. And this quote from the journal Curious really hammers the point home. This is not a small thing we're talking about. It's one of the biggest demands your body can possibly face. This emergency response system is vital for survival, for sure, but if that alarm bell stays on for too long, it can start to cause its own set of pretty serious problems.
So what happens when that stress alarm just keeps ringing? Well, it can knock our entire internal chemistry way out of whack. The hormones that get released during this response can totally change how your body handles fluids and essential minerals. So let's dive into the most common imbalances that doctors are looking out for after an operation.
And number one on the list, the most common culprit, is something called hyponatremia. That's just a fancy word for low sodium. It happens all the time, and it's usually caused by a 1-2 punch. The IV fluids you get during and after surgery, combined with those stress hormones that make your body cling to water, which then dilutes your sodium levels.
And what does low sodium even feel like? Well, the symptoms can be kind of vague. You might feel foggy, confused, weak, maybe a little nauseous. All things that a lot of patients might just brush off as, oh, that's just the anesthesia wearing off. But it could be a really important sign of this underlying imbalance.
Next up is hypokalemia, or low potassium. Now, potassium is absolutely essential for our muscles to work correctly, and that includes our most important muscle of all, the heart. When potassium levels dip too low, it can lead to weakness, cramping, and even really dangerous changes in your heart's rhythm.
And this right here is exactly why the hospital staff is so incredibly vigilant about monitoring your electrolytes. An imbalance isn't just some number on a lab report. It's a direct window into your heart's stability and how well it's coping with the stress of recovery.
Of course, this risk isn't the same for everybody. The specific type of surgery you have plays a huge role in what kind of electrolyte challenges your body is most likely to face. It's not a one-size-fits-all problem at all. And to really put that into perspective, check this out. One study found that a staggering 54%, that's more than half, of all patients who had gastrointestinal surgery developed a significant electrolyte imbalance. That just goes to show you how common and how procedure-specific this whole issue can be. So the takeaway here is that the treatment has to be tailored to the surgery. I mean, think about it. A neurosurgery patient might struggle with low sodium because of hormonal shifts in the brain, but a cardiac surgery patient, they're more at risk for low magnesium because of the heart-lung bypass machine. And like we just saw, GI surgery often leads to massive sodium loss, which needs a completely different game plan. Okay, so we've seen the problem. We know it's complex. So what's the solution? Well, the good news is that hospitals have a really well-oiled system for diagnosing and managing these imbalances to get you back on track safely. And that system is, well, it's systematic. It's like a 3-step investigation. First, they look at the big picture. What kind of surgery did you have? How much fluid have you taken in? What were your pre-existing health issues? Then they do a physical exam, looking for clues, checking your hydration and how you're doing neurologically. And finally, the lab tests give them the hard data, a precise chemical map of your blood and urine. Once they have that data, the team just springs into action. This means meticulously tracking every single thing you drink and, well, put out. They're constantly rechecking your blood work, often monitoring your heart with an ECG, and very carefully giving you IV fluids and electrolytes. It's a real team effort, and it's all highly controlled. But that super controlled hospital environment doesn't last forever.
So what happens when you're discharged and sent home? Well, the monitoring doesn't stop, it just kind of shifts to you. Let's talk about how you can take control of your own recovery and keep that delicate balance at home.
Okay, this is a super important point, especially if you're recovering from any kind of GI surgery. You might be tempted to just grab a sports drink, right? But they are not the same as a medically formulated oral rehydration solution, or ORS. An ORS has a very specific scientific ratio of salt and sugar that's designed to maximize how your body absorbs it. Sports drinks, on the other hand, are mostly sugar and water and can sometimes even make fluid loss worse. And here's the really great news. You can actually make a super effective ORS right in your own kitchen. Whether you start with plain water, a low-sugar Gatorade, or even some apple juice, just adding the right amount of salt creates this incredibly powerful rehydration tool that's way better for replacing significant fluid and electrolyte losses.
It all really comes down to some pretty cool science. That specific combo of salt and sugar actually activates a special little doorway in your gut. It's called the sodium-glucose cotransporter, and it literally pulls water and electrolytes into your system way more efficiently than water could ever do on its own. It's a simple but totally brilliant physiological hack.
And finally, you just can't forget the power of good old-fashioned nutrition. Protein is the building block for repairing tissue. Foods packed with potassium and magnesium, they support your muscles. Calcium and vitamin D, they're crucial for healing bone. And of course, getting enough fiber and staying hydrated is so important for keeping everything moving, especially when you're dealing with the side effects of pain meds. So, we know that today the gold standard is all about diligent monitoring and targeted replacement. But what does the future hold? The really exciting question is this: how soon will we be able to use advanced biomarkers, things like specific inflammation signals in the blood, to actually predict who is at the highest risk? That would allow doctors to step in and prevent these dangerous imbalances before they even have a chance to start. Now that is the next frontier in making surgical recovery even safer.